Hi everybody, thanks for joining us. For those of you who don't know me, my name is Peter Llewellyn. I run the services at MedCommsNetworking.com. So information services, resources for the global MedComms community, by which I mean people who work in and around medical communications, medical education, and medical publishing. One of the things we're doing is we're running regular webinars now and recording them. You'll find lots of recordings now over at NetworkPharma TV. But we're running these regular webinars, which is a great way of involving people from all over the world, speakers, audience, and so on. And we've got a good number of people listening to us today again. So thank you for joining us. Absolutely delighted today. We've got Tim Hardman and Stephen Walker with us. We're going to talk about the results of a survey, a working practice survey that the MedComms networking community were involved in supporting back in sort of July, August time. So assessing the impact of COVID-19 on current and future patterns, working patterns. So Tim, I'm going to go over to you to sort of kick us off with the results, and then Stephen, you're going to talk a little bit about the wider environment, as it were. So Tim, over to you.
Okay, well, thanks to everybody. I'll just kick off my presentation, as I know Peter is very keen for me to whip through this very fast. So those of you who may know, we ran a first survey in 2020 at the start of the pandemic, and for about a couple of weeks, and we got around about 700 responders. We published that, and details can be provided, but after about a year, we had a lot of calls for us to run the study again. People felt that things had changed and we weren't necessarily working in the same environment. So a year on, more or less, we ran the study again. Just a little bit background about the study. As we all know, we all faced changes at the start of the pandemic. We embraced the new virtual workspace. We introduced changes quickly, and we got out there and we found ways to continue working. Everybody faced disruption and change, but we're looking to start to reverse the lockdown after about a year, and enlightened employees have been asking, and employers have been asking themselves whether we've learned any lessons. So we conducted the second survey. And the surveys were very similar in structure. The first one was really about the changes that were going on, 52 questions, 4 free text entries. The second survey a year later, 53 questions, 3 free text entries, but this time we were trying to learn if we could take anything away from the lockdown experience. So first time, 750 odd people taking part. Second time, just over 900. Were they similar populations? Were they the same population? Very, very similar. We had a large proportion of female responders, probably the greatest group. Very few, sadly, youngsters, only about 16% under 30 years old, which I think is a great loss, but there's been a lot of talk about millennials and younger people not really engaging, so possibly a result of that. Most of our responders were married, most were living in their own homes, about 40% were living with a child, and the greatest percentage of responders were in the UK, which probably reflects the networks that we use to get people to respond. The next greatest responders was actually the US, which was very grateful for that. And I would add here that I should have mentioned this earlier, that I think both, all of us are very grateful for you taking the time to take part in the survey. Nearly half of our responders were involved in MedComms, and about a quarter in biotech, biopharma, 11% in CROs, and then a variety of responses from people who didn't see themselves in any of those roles, but there you go. Most of them, 32%, identified themselves as either medical writers or editors, and then just under 40% were at the director level, and just nearly 50% were actually managing others. So you could probably say that our population were quite well settled in their employment. And you could see here that 9% of responders felt they were financially worse off. That's quite a small percent that felt they were financially worse off, and that's actually much lower than our previous survey, where it's 18%. In contrast, nearly 70% felt they were better off. So I think in the MedComms and in the pharma industry, I suppose the business to be in during a pandemic, there seemed to be a small shift in the type of people who are actually doing freelancers or contracting from maybe 25% down to 19%. It is possible that that's just an artifact, but it could be that people were looking for more secure employment during the times of troubles. We, like with the first survey, we have an employment fluid population. Most people staying in their jobs 1 to 5 years. Majority of survey population were working full weeks. That's a 30, 48 hour week. And most responders were full-time employees, as I said. Over 50% had the option to work from home before the pandemic. So it's not as if working from home was a massive shock. And the daily pandemic commute for both was very similar. So I think I've gone backwards, sorry. I think we can pretty much say that the populations were very similar, at least, and I'm sure we touched the same pool of people in our contacts to take part. So you can't hold a survey like this without talking about COVID, obviously. So the 12-month experience, people feeling health anxiety, didn't seem specifically to change. As you can see, the two 2020-21 distributions are very same. Interesting, 11.6% said they'd had COVID. We did have to ask, I think it was essential. And this is versus the estimate of the UK government, which obviously the UK is most of our survey population, that says it's about 10%. Interestingly, the ONS estimate says it's 0.5 to 1.5%, which it's hard to reconcile those numbers, but it does seem that knowing about the pandemic, as you might say, as we're in the business, doesn't seem to protect us from getting COVID. 36% that they said that they remained uncomfortable if they were being expressly asked to travel for a face-to-face meeting. So yeah, I think we're fully aware of the infection that we've had. Obviously, halfway through, it's always good, and any of you have ever run a clinical study or carried on any experiment, halfway through any experiment, somebody will come along and interfere. And at that time, we had the UK government, during the time of the survey, we had the UK government and Google and several other people commenting about how we were going to change the working conditions for people within all industries if they didn't return to work. For me personally, as an employer, I found that horrific that it would even be suggested, but I don't know whether that affected our responses, but certainly just to establish 93% of responders were working from home, which is slightly lower than the 2020 number. So have we learned anything? Has the employers learned anything during the time? So we asked people about how they felt about their ability to grow, that was learning, and it seems that previously we have had a positive shift from where we had. More people feel that they can grow, they get the learning. I think employers seem to have worked out to make sure that their employees, or at least better work on their employees feeling valued, and then also about feeling engaged and getting the recognition they need, and they are feeling relatively well motivated. So these numbers certainly show a shift to more positive, which we hope is the employers getting, the employers being more aware of the need for this. I would say if you look at these numbers in detail, you see that there's actually the people that were probably unengaged in the first survey may have actually become less engaged, and the ones that can be saved, as it were, have move to a more positive way. So it isn't quite as clear cut as it seems, but certainly everybody, a lot of people, I shouldn't say everybody, a lot of people seem very happy about their job security. So employee status, how's that improved over the time, or has it improved? The data seems to suggest that people are very happy with the daily routine that they can set up. They're very happy with the level of concentration that they get and their productivity. They still seem to be enjoying working from home, or at least the situation that they're in at the moment, whether that's home or hybrid. And that's very much reflected in the free text entries that we've got. Positive here, desk eating is always seen as a negative, and we seem to have a significant shift away from people eating at the desk. However, one of the key findings that found was that people are shifting away from the amount of time that they're taking for lunch. And you wonder what that underlines. And that comes out in when you look at the working practice effects. People are saying that they are working harder than ever, and I'm markedly working harder than ever. There's a general anxiety about the work load that they've got. I'm interpreting there that it's the workload, but general anxiety about the work that they've got. And they have markedly moved into the negative in terms of their work-life balance. And for me, I'm interpreting that people are working harder and longer. And one of the responses here is over 55% are doing more than 10% of their work out of normal working hours. And if you compare the 2020 profile to the 2021 profile, over 43% working over 40 hours. And you can see these numbers here, 40 plus hours, 21% in 2020, 43.2%. We are working too hard. And I think if you take away, you're working, you're sitting at your desk, you cannot have a life. And we've seen a marked effect from 26.8% saying they felt lonely and isolated to 45.6%, guys. That is a horrendous change. And I think it's something that we need to look at. So is that affecting our health negatively? Well, on the positive side, we all seem to be drinking less, which I don't know whether that's a good thing, but we're all feeling very guilty about not getting the exercise that we want. And we see this shift here in the exercise. And I'm not totally surprised that we see a shift, slightly negative shift in terms of people feeling vigorous, feeling restful, and yet they're spending more time on social media. The positive side is that we don't seem to have changed our relationship status. So good news. That might also mean that everybody who was going to broke up in the first few months of the pandemic. Can't tell you about that, but there you go. So for me, before I move on to the next part, there are two elephants in the room from statistics that we got. There's something wrong. There is something clearly wrong if 15% of people say their employers are not providing them with the equipment they need to work from home. There's something wrong. Either there is a mismatch between what you expect to work from home, or you are not asking for what you need for work from home, or employers are just not listening. And I think if an employer would have to be, I don't want to use a rude word, but not very intelligent if they don't give you the tools and don't have you working effectively. If you look at the current survey for the next 5 years in the UK, the latest government release, there will be 150,000 people short in the workforce, in our workforce, specifically the pharma sector, the MedComms sector, all that. There will be 150,000 people short. So if they're treating you badly, 15%, then they must be educationally subnormal, perhaps, shall we say, or perhaps you should ask yourself, what is it you really need to do your job, and are you asking for it? Another key performance. So that, for me, that's employees need to communicate better. On the other side, employers, over half have still not performed a health and safety assessment of people's workstations, and that's horrific. If you're listening to your employer, make sure you get that done. So, employers moving forward, these questions: has your employer devised working guidelines, charter for working home? We've got, I believe that is 64% saying no, they haven't. And I think that is something that everybody should be working on and should have in their immediate plan, especially considering how things are affecting the workforce. It's the job of every employer to be the greasy rag that keeps the engine running. And I think this is a crucial factor. Has your employer provided you with formal health and safety guidelines? No, or at least, yes, some have, but not enough. Has your employer asked for your opinion on future working arrangements? This is quite hopeful. I think it's time for that engagement. There's been a lot of talk about hybrid relationships and maybe going into the office different amounts of time. I think that's very positive, those discussions. But still a very, very small amount about talking about setting up new contracts. And effectively, that discussion has to go on. Has to take place to formalize the future working processes. Employees moving forward, I think there's a certain amount of honesty. There's always more employees than there are employers, obviously, and so that means there's always going to be a louder majority complaining. But I think there's a certain amount that there has to be some honesty here. Very few people are notifying, say, their mortgage provider, their insurance company about their working from home. We've got very few patterns of that, or landlords, and that's a concern. And then there's also the concern about whether you've got a safe place to lock away company equipment safely and actually materials, and whether that keeps them private and confidential. And there's still an argument or a discussion take place about how proper is your working environment. How often do you work from insecure areas, such as, I just work down at the coffee shop, which sounds lovely, but effectively open wireless networks, paperwork left on your desk, it is a confidentiality nightmare. We had a year of experience, and I think that's had a positive effect on everybody. I think we now, a greater percentage of our survey population felt that we won't return to the way that we worked before. We are going to work in a different manner. And I think that's positive. I think on many levels that is good, but I think it needs to be done properly. Just wanted to give you some quick snapshot. I don't want to take too much time because Peter keeps, see, he just did that. So I just wanted to give you quick snapshots of the responses to free text. This question about which parts do you find most difficult? We had 35,000 words in 2020, 20,000 words in 2021. As you imagine, that's quite a lot to work through. So I'm still going through and scoring it, but hard to build relationships with teams, feeling isolated. Big one, I think, at the initial lockdown was managing children, which hopefully that's gone away. That was a major impact and was supposed to, one of the key factors we thought that was responsible for the negative outcomes from the last survey, but in fact, it doesn't seem to have happened quite so much. One of the key factors here, overworking, spending too long at work. 2021, distractions, poor IT, still poor IT. Who has still poor IT? You've been doing it for a year, but an interesting feeling of guilt that these things came up quite a lot. Difficulty concentration, switching off from work at the end of the day. It seems to be a pattern coming here. Lack of social interaction with people in the company. What people found good, Flexibility working hours to fit around small children. I think that was a crucial thing that we needed to do during the first lockdown. Being less stressed, no commuting, commute. Let's face it, none of us like doing it, or do we? The ability to concentrate more in a quiet place, yes. 2021, no commute still there. Going in the garden, finding the fridge, being able to do household chores. I do. It's very nice of people to be quite open about this, but there is the thing about the issue about being flexible over their hours. That is not necessarily the same as working from home. And that does raise an issue as an employee, not for me, but for managers. So if a manager is working a team of 4 people and one person says, well, I like to get up at 6 o'clock and I will be working through till 2. And another one puts, well, I get up at 10 o'clock and I'm going to be working through till 7. That puts a burden on managers. And I think there's a grown-up conversation that needs to take place over the difference between hybrid, what hybrid means, and what flexible means. And again, the government, the UK government, is stepping in with its big feet and saying, oh, well, we're going to make anybody to be able to do that. But that is not easy. And my concern is that that managers have a difficult enough job in the first place. So that's that. What are your thoughts about hybrid models moving forward? Everybody seems to be positive about hybrid models, but I think there's still a lot of uncertainty about what it actually means. And I think that means that we are not there. We do not know it all yet. And there are lessons to be learned. So executive summary of what I found. We may have seen a switch from some freelancers to more traditional employment models. That might be because of flow of work or concerns of that, but I suspect they shouldn't have had to. Hybrid or home working, there currently seems to be no break. There's no foot brake. There's no emergency brake in the extent to which we're working, and we need to address this as it's affecting our lives. I really believe that. The way we work is changing, and if we want to see a new partnership between employee and employer, there has to be investment from both sides. And we need to establish some industry charters and company guides and that's the responsibility of everybody. You can't sit on the fence and say, well, I'm waiting for my employer to do this. You can't sit on the fence and say, I'm waiting for my employer to test my workstation. You can't say also, oh, it's okay, I'm going to work from the bed. Peter and I will both tell you that working from non-proper places, you end up with injuries that can be life-changing. So that's my conclusion. Thank you again to everybody who took part. Thank you to the organizations that helped us. AMWA, Peter will mention, Stephen will mention a few afterwards. Certainly AHPPI, Euphomed, groups that I'm involved with that have gone out there and promoted this. And yeah, thanks a lot, everybody. Peter.
Great, thanks, Tim. Sorry, moving a little bit swiftly on, but because we are going to run out of time. I'm keen to get the audience throwing some questions at us. But what we're going to do next is Stephen's going to just have a little bit of a look at the sort of overall working environment. But Tim, if you can share his slides, Stephen, you're going to guide him as to which ones you want. And then we'll have a bit of a Q&A. So guys in the audience, again, you've got 2 text boxes. Do start sending your questions and comments in as we're talking. We'll pick up on those in the conversation. So Stephen, over to you.
Well, thank you very much, Peter. And Tim, what an amazing insight into the data. I'm so pleased that we actually did run this again. So well done to you and for analyzing it all so quickly. This is a medical writer drowning on the amount of work. And I certainly feel much busier than I was before lockdown. Next slide. It's a confusing picture. So on the one hand, we're being sort of encouraged to get back to work. On the other side, some organizations and health professionals are sort of being very worried about us going back to work. I see on the underground every day, less and less people are wearing masks. I also see that our new health secretary is keeping in the background the fact that we may have to go back to some kind of a contingency plan working from home if the winter pressures increase. Next slide. The COVID situation, as you all know, is far from over. So here in the UK, we're running at 34,000 new cases every day, compared to Germany, where it's 7,000. Obviously, the UK population is 65 million, Germany 82 million, 67% vaccinated, doubly vaccinated here in the UK, 64% in Germany. Why is that? Despite such a high vaccination, it is still a problem here in the UK. Next slide. Surveys, you'll be well aware that there have been a number of surveys, I was interested to see popping into my inbox today another survey from the PM Society. There is also a commercial company I see called Plan B, who is actually offering to conduct surveys for your employers, which allegedly will help to maximize staff productivity, satisfaction, and well-being, and optimize the workplace opportunities. So they're offering a commercial solution to this. So whenever there's adversity, there's always some opportunities. But anyhow, I'm going to concentrate on the BBC survey. The BBC survey, they did two surveys, but the most recent one, which is, you probably saw this, was published online on the 16th of September. They looked at 1,600 working adults and over 500 senior managers. Jim, next one, please. And the headline results from this is that basically most people do not expect things to go back to the way they were beforehand. So 70% of senior business, over 70% of senior business leaders and over 70% of the general public think that it's likely that we will never return to the same situation as we were beforehand. Tim, next one. Similarly, a lot of people have quite enjoyed working from home, and they want this to continue. Some of them have said they'd like to work from home all the time. Some of them they'd like to work from home some of the time, but it also depends on where you are in the country. Next slide, Tim. So in London, they want to, 44% said they want to work some of the time, and for 25%, they never want to work from home post-COVID. I have to say, from my own personal experience, I found it quite a struggle, and I now quite enjoy going into the office. And things are different around the country. Next slide. So you can see that if you're in Scotland, you're least likely to want to work from home going forward, whereas the percentages actually change as you go progressively further south. Next slide. Also, there are concerns in this BBC slide about home working maybe hurting younger workers, and this was pointed out by our Chancellor. Younger people working from home may struggle to progress their careers. They may also have more, they may feel less supported. They may have more distress in their role, not having people around to talk to. They're not used to this. And this is obviously very different from someone who is in their 50s or 60s or whatever, who's kind of sort of seen it all. So it may actually harm young people continuing to work from home. Next slide. There's also conflicting sort of views amongst bosses. So the BT boss, Philip Jansen, on the one hand, he's saying, going into work a few days a week is all fine, and they're going to do flexibility. But obviously, if you have certain jobs where you have to be out on the road, like they're engineers, they're not going to have much in the way of flexibility. So, what BT want to do is to create collaboration, dynamism, teamworking, creativity. And for them, their view is that, you need to actually go into the office to do that. Next slide, please. Interestingly, there seems to be a general agreement, and there was evidence of this actually before lockdown, that productivity really isn't actually affected by home working. Maybe this is because you don't have to commute, you feel less disturbed by colleagues, you feel you can get on with things, but we needn't be afraid about home working. It does seem to be equally or possibly even more productive. Next slide. Some notable points that came out from the BBC survey. Most people think that their bosses will allow them to continue for working at home for some time. It's interesting, there was a trend before lockdown that more and more people were working from home some of the time, and this appears to be increasing. Possibly some inequalities will now be raised or reduced or possibly made even worse by lockdown, and that's something that we need to talk about. It may also be that women's careers are actually boosted because having childcare and having to look after their children, look after the home perhaps, these will be less of a hindrance. So this survey, so it may be that going forward, there is a suggestion that women's careers may actually be helped by this. Next slide. So a bit of a nightmare at the moment for recruiters. People used to fit their lives around work, and now people are increasingly demanding home working when they go to a new job. And this is causing lots of problems for recruiters. On the one hand, employers want people to go back to normal, be there in the office, but staff are not playing by the board. And obviously now there are so many job vacancies out there that employers now need to be creative going forward. So the actual job adverts are starting to change, and the number of jobs that are employers are offering home working does seem to be on the increase. Next slide, Tim. We work in such a diverse area in MedComms. I was sort of really so surprised that we've all taken to home working so well, and I thought there were going to be sort of more crises going forward, but by and large it's worked very well with our clients, with our staff members, and that was a surprise for me. So in summary, really just looking at our survey, I think what was unique about it is the fact that we had two very large numbers. We asked some really in-depth questions, whereas, for example, the new PM survey is just basically looking at, employment, or a very, very simple thing. There are no touchy-feely things in there. And the other strength about us is looking at different countries and, of course, two time points. So this is really helpful work, and I think it will help to move the employment landscape forward for us in MedComms. And last slide. Tim, yes, and that's just our slot. So thank you very much for listening. Very short and sharp. We could have looked at the other surveys, but they all seem to give similar messages. So thank you for listening.
And thank you, Stephen. Thank you, both of you. Just a couple of quick points for context here, I think, is useful. Clearly, there's a lot of data in there. There's a lot of, what my interest in doing something like this is that we raise some discussion, raise some questions. I'm hoping people in their individual companies will maybe stream this video or something afterwards, and they'll use it as the basis of discussion. They'll compare some of those results with internal results, in-house surveys I know are going on, and so on. We could have gone in all sorts of directions. There's a lot of data there, and we've skipped over a lot of issues there. But if it's making people think, that's useful. One thing I wanted to say was very straightforwardly, I've made a bit of a thing about it in particularly the last 18 months or so. I've got some strong opinions on remote working, flexible working, virtual working, hybrid working, etc. But I don't employ anybody. And I'm very, very straightforward about this. I can look at other people and other organizations and speculate a bit. Tim, Stephen, you both run companies. So you're facing some practical challenges that I don't actually have to face. And I do recognize that it's very different for someone like me to say, well, this is how it should work, that's how it should work. But if you're running a business, and I think, Tim, you were saying, if people all want to work different hours, it's all very well saying employees should be allowed to work how they want to, which is what a lot of people are saying. But if they all want to work different hours and different ways, how do you actually come together in the middle? And I think there's lots my personal view, lots and lots of practical problems here, and we are right certainly in the middle, if not very early on the stage of working out how all this is going to work. But come back to MedComms generally feeling very positive. And yes, I know a lot of flexible working is starting to happen, but there's been a lot of work in the last year or so. One of the questions that came in quite early, Steph was saying, again, we'll just throw some of these questions quickly around, but in the audience, please throw your comments into this. Steph sort of said, does the increase in working hours reflect change to work from home? Or is it to do with more the fact that MedComms is just busier than ever? I mean, some of these questions are impossible to answer actually from a survey like us, but what's your sort of sense, Tim?
I think we are busier than ever.
We are, yeah.
But I don't know about you. I do know a process where work begets work. So you did it faster. There's no way you will ever run out of material. So if you do it faster, you do it harder, you will get the next job. Strangely enough, you will never run out of those jobs. So I do think that, as I said, there's no break. There is no foot brake. You have, when you go home, when the lights go off at the office, you go home, and commuting takes, whatever you do, commuting takes energy out of you. You get home, you want to have your dinner, you want to relax. That is just changed. That landscape, 90% that landscape has changed now, and I do believe there's just a pressure for us to do that. I'm guilty. I did the bloody survey. Sorry, pardon my language, and I am the guiltiest party. I was up till 2 o'clock this morning, working for a company that was screaming at me from Brazil. And it's like, why am I even doing this?
Okay, so I mean, again, we could go into a lot more depth on this one, but this is a hugely difficult problem, isn't it? Because some of us like working, and why shouldn't we work? Frankly, and work odd hours if we want to. But I think there's an important point in here, which is that it's not always the employer that needs to worry so much about managing and controlling the employee. There is a two-way thing going on here. Employees and employers need to have a conversation about what's acceptable. But in my view, it's too simplistic to say, I don't know, don't send an email out after 5 o'clock or something like that. I mean, it doesn't make sense. And we're working in a global environment anyway. Stephen, have you got any reflections on that sort of, how much of it is just loads of work and how much of it is we're just not managing the work from home and sort of scenario? Do you see what I mean?
So I think there's some things that have contributed to this. So for example, the change in the medical device regulations, there's now more work to be done. Certainly, the number of staff vacancies across the MedComms world seems to be increasing. So that seems to be reflecting an increased need. As you say, good work begets good work. So I think there is more work, there's more demand for work. Yes, there are certain contributing factors. Interestingly, the attitude from the clients that we've been looking after, they also seem to be doing more and asking for more, whether they've simply been sort of sitting there reflecting on things. It's interesting that BMJ has had more articles than ever during lockdown. So people are sort of sitting around thinking about things, and that probably generates new work as well.
Yeah. Katya's question I thought was quite interesting, and maybe is worth just spending a moment on. The sort of all this flexible working, and we've proven that we can be more flexible. How much is that removing barriers? Maybe some of the invisible barriers. Maybe there's some obvious barriers in terms of, the employees you can take on might be spread around the UK. They don't have to be within commuting distance of your office, sort of thing. But also the sort of invisible barriers, which does intrigue me a little bit. People who may have, whether it's childcare, we've talked about childcare, but there are lots of other issues, or someone who gets lots of migraines or something, I don't know, have a bit of problems in the old-fashioned way of working, if you like, which can we be more inclusive because of the flexible working approaches that are starting to happen? Is that happening in real life? Am I making some sense, Tim? Sorry.
Yeah, no, I think I agree that it can be more inclusive, but if you find somebody, I can see Isabel, who's one of our writers, is here. She's been, many years she's been working from Edinburgh. Our offices are in London. She is perhaps one of the best writers I know. Sorry, Isabel, for bringing you up, but you know, there's no way I would not employ Isabel because of that. So any employer who looks at a good writer or a good worker and says, oh, well, because you're there, then must be insane, must have something wrong. I mean, we recently had to lose a writer because of Brexit, because she works in Spain, and yeah, I gutted, absolutely gutted. I mean, I would I'm holding back from making a political comment, but yes, it's really, really upsetting that we had to do that.
Okay, so I guess there's pros and cons to all sorts of things going on in the environment, but flexible working can open up some interesting opportunities. Stephen, did you see that?
Yes, so I think this is a godsend, as I said, for people at home looking after children or sick relatives or whatever. I think also is a godsend for disabled people, really. You know, people who might not do so well at an interview. That in my view, there's now so much extra demand that you're going to take a chance on many people. It may be now that you get a chance to take a chance on more junior people who've got no experience. So that's my view. But I am also aware that some companies have been laying people off, but there does seem to be a much larger market now.
Yeah. It's interesting. One of the comments came in that somebody's working for a company that laid a lot of people off. Therefore, there's a lot of work to be done, sort of thing. So again, I mean, maybe we're a bit simplistic within MedComms. There's a number of different sides to MedComms. You know, if you were part of the events management business, running around the world doing face-to-face meetings, your background will be slightly different over the last year and a half to the people who've been working on publications and so on and so forth. So that's sort of thing that maybe need to be taken into account a little bit. Yeah. I did make a comment, it's going back a little while on social media, but I did think it was interesting when I started thinking, like, you know, where it started, where it's come from. In 2019, a medical writer, you know, see a job ad and it's benefit of working with us, flexible working, you can work we'll give you a laptop, you can work at home a day a week or something like that, has completely turned on its head. And now the flexible working is, and you can come to the office one day a week, sort of thing. I just find that quite an interesting thing to sort of think about, but I still think the practicalities can be more troublesome than it sounds, sort of thing. Yeah. Just having a look at a couple of quick questions here. Nita's asking about core hours. Core hours 10 to 4. That's a good place to start, yes. But if you're saying to people literally you can work anytime you like, it gets a bit difficult to work out what the core hours are. Stephen, you're trying to say something.
So I was just going to make a plug for our charter. So Peter, Tim, myself, and Catherine have been sort of playing around with, do we need some kind of charter, something which kind of employers and employees could sort of sign up to, which sets out the basic ground rules, you know, how you should work from home or in the office, you know, what equipment you should apply, what health and safety, how to manage people. And we just thought a simple little exercise where you have a few bullet points, which employers and employees sign up to, might be a possible advantage going forward.
I was interested from the slides you showed, Tim, that I mean, a lot of it was positive in terms of the direction of travel, but there was still quite big question marks over, you know, how, I mean, employers might be talking more to employees, although it's still not everybody, but, you know, there's still a long way to go before you're actually going all the way and changing contracts and putting in place absolutely the sort of the requirements that need to come in, sort of thing. And also I just thought it's worth saying again, from your slides, a lot of positivity in terms of we're moving in the right direction. Lots of people actually are quite positive, but there are significant minorities of people at every step of the way who are saying, I'm struggling with this. And I think that's, you know, that's a problem for management and organizations, and I can only sit back and watch, but there are problems out there. We shouldn't forget that in amongst all the positivity about working from home works great for MedComms, sort of thing. You agree with it?
I would say there that one of the key factors is the missing population. So we have a very small number of responders who are younger. And my concern is they're living in a bed sit with not the great places to work. They might have other people living in the same area, same living area. they won't, I don't care what anybody says, they won't get the interaction with their colleagues that will bring them on faster, that will train them. And I know the most irritating thing is your boss turning up at your desk. It really is irritating. I've been there. Guess what? I was a young person once. It's really irritating, but sometimes a little bit of frisson of adrenaline actually gets you thinking harder, and you get creative. I think it's so I think there's a lot being lost. I fear for the younger generation. I really fear for the younger generation, because there's a lot of very well-paid people about my age who've done very well out of the pharma industry one way or another, who are retiring now. They're saying, fair enough, I don't need to carry on. Who's going to train the youngsters? You're not going to get it all from online training. I still have concerns about that. Yeah, I think you're absolutely right. We are not there. I think we've learned a lot, and I think that's a good time to dig in and say, right, let's attack that last 20%. And I think it is as much as 20%. I think.
I agree. And again, so just to cover off a couple of questions that came in about further analysis and so on, I'm not going to try and put you on the spot, but Robert, for instance, asking about comparing US and Europe and so on. I mean, there's a limit. I know you're going to do more. There's a limit to what we can do. And I come back to my first point, that what we're trying to, maybe all we're trying to do is raise conversation points here. We're not going to be able to answer some of the questions that some of the people have asked at a very specific level. But also, just to come back to a point that I always make in these sorts of conversations, because I hear people making sweeping statements. You know, the youngsters are having a terrible time because they can't come to the office because they're in rented accommodation. They want to get out of their bed sit, or they're with their parents. The old people are, you know, happy because they're at home and they've got their gardens. Actually, I've talked to youngsters who just cannot believe that we used to commute in and out of an office, because why would you do that? That's just ridiculous. Of course we can do it on the back of a mobile phone, and they're perfectly happy. And I know plenty of older people with their big gardens and all the rest of it who are, you know, running out of the house to get back to the office and things like that. It's quite individual. That's the thing that's always occurred to me. When you're talking to individuals, it becomes very individual. Your circumstances, my circumstances, are so different from yours, from anybody else's. It can be impacted by kids, by your partner's job and situation, by what's going on next door, your own health, all sorts of things. It's so individual. And what we've done is, instead of going, by and large, people go into an office, whatever the problem is, we deal with it, and they'll accept whatever you do there. We've sort of gone, well, actually, we all want you to be absolutely happy doing what you want to do in the way you want to do it. And I come back to the basic problem I have, which is that if you've got a team of people all trying to do different things, and that's before you worry now about the fact that people have got lockdown puppies. I mean, you know, my wife was trying to organise a do for her big department, and the excuses started to come in at the last minute, like, well, I can't leave my new puppy on its own. I brought a puppy. I mean, it's going to be fascinating, and I hope that what we're doing here is providing food for thought. As I say, I'd like to think that people will sit down within their own individual agencies, maybe compare it with individual data. Maybe individuals will just sit and think about this stuff more. I know I'm going to wrap up in a second. I know, Tim, you'll be happy if people want to talk to you about more in-depth data. I know we're going to try and publish the full paper. As a reminder, last year's paper, just to point out that we can, you know, that if you want to go and find it, it's Emma's Journal, Medical Writing. It's March 2021. If I just say that, you can find it easily enough. But we will be keeping people informed about the publication of this data. Yeah. But I think it's been very interesting. But I'm very aware that even this is a few weeks ago, this data from, and things are still changing. And conversations I'm having with people are still just very fluid. Lots of people very positive. I think lots of people have still got a long way to go to work out what's going to happen, really, and be honest about it. But hopefully we've helped by at least putting some of this stuff out there. And the recording is going to be available on NetworkPharma TV later on. And if you're watching this video later on, please, we'd love to hear your feedback. So I'm going blah, 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 blah to finish up very quickly, because I'd like a few minutes when we're unrecorded. So Tim and Stephen, I'm not going to ask if they've got a final point to make. I'm just going to say a huge thank you to you both for joining in. We could have spent all day talking about this. We could have gone in all sorts of directions, but I think we've given enough to give people a flavour of what's happened and to give some people some things to think about. I know you're both very happy to hear from people if you if they link out, sorry, if they reach out via LinkedIn. That's the easy way of contacting you both. I'm always very happy to hear from people. Obviously, my little plug, come to medcommsnetworking.com. You'll find all sorts of information and activity, and NetworkPharma TV for loads of videos covering all sorts of topics, including these sorts of topics. So that feels like a bit of a rushed way of finishing, but I'm going to say thank you guys. To the audience, I'm going to say a huge thank you for joining us. Don't rush away if you don't need to. We've got a few minutes when we'll relax a little bit and we can carry on talking. Guys, as always, just a wave to say goodbye as I close off the recording. So bye and thank you very much. Take care. Bye-bye.